Introduction. The spine consists of vertebral bones stacked one on top of the other that surround and protect the spinal cord. Spondylolisthesis is a condition in which a vertebral bone slips out of place in relation to the one beneath it. This causes misalignment and narrowing of the spinal column, a condition called spinal stenosis, which can put pressure on a nerve, resulting in pain in the lower back, buttocks, or legs with walking or standing. As the spine tries to stabilize itself, the joints between the slipped vertebra and adjacent vertebrae can become enlarged, pinching the nerves as they exit the spinal column. Spondylolisthesis mostly affects the lower back region and is more commonly seen in teens during their growth spurts and adults over the age of 40. Types of spondylolisthesis. Some of the types of spondylolisthesis include degenerative spondylolisthesis. This is the most common type and occurs with aging and arthritic changes in the vertebral joints. Isthmic spondylolisthesis. This type is seen mostly in children and adolescents and is related to sports activity. Small stress fractures develop in the pars interarticularis, a segment of bone between the facet joints at the back of the vertebrae, which can lead to spondylolisthesis. Congenital spondylolisthesis. This type is seen at birth and is the result of abnormal bone formation while in the womb. Traumatic spondylolisthesis. This type occurs due to a direct trauma or injury to the spine, as in contact sports or motor vehicle accidents. Pathologic spondylolisthesis. This occurs as a result of weakening of the spine due to osteoporosis, infection, or tumor. Post-surgical spondylolisthesis. This type is very rare and occurs due to slippage of the disc as a result of spine surgery. Causes. The causes of spondylolisthesis are multifactorial in nature and may include trauma or injury, spondylolysis or stress fractures, fractures, bone disorders, degeneration due to aging or overuse, joint injury due to illness or arthritis, abnormal bone formation while in the womb, family history, growth spurts, tumor, infection, previous spine surgery. Signs and symptoms. Many people with spondylolisthesis do not have symptoms and don't even know they have the condition. However, for those who do experience symptoms, they can include the following: pain in the buttocks or lower back, weakness in one or both legs, radiating pain to one or both legs, difficulty in running or walking, stiffness in the back and legs, decreased range of motion, tight hamstring and buttock muscles, numbness and tingling down the legs, loss of control of bladder or bowel function. Diagnosis. To diagnose spondylolisthesis, your doctor will review your symptoms and perform a physical examination. People with spondylolisthesis find it difficult to raise the leg on the affected side forward. X-rays of the lower spine are obtained to visualize the affected region of the spine and to determine if the vertebra is out of place. A CT scan may be ordered to evaluate the condition of the nerve if the misplaced bone is compressing the nerve and causing associated symptoms. Treatment. Spondylolisthesis is treated according to the degree of pain and how far the vertebra has shifted out of position. Non-surgical treatment may be recommended to relieve symptoms and help the vertebra return to position. This can include physical therapy, the use of a back brace, anti-inflammatory medications, or steroid injections. You are advised to avoid strenuous activity or contact sports until you heal properly. If pain due to nerve compression is severe or persistent, or if the vertebra has shifted far out of place, your doctor may recommend a surgery called spinal fusion. The procedure involves the removal of a portion of the vertebra compressing the nerves and other vertebrae, followed by the removal of the disc between the vertebrae and fusion of adjacent vertebrae to improve stability of the spine and minimize pain. Following the surgery, your surgeon recommends a physical therapy rehabilitation program to regain strength to the surrounding bones and muscles, promote faster healing, and help you return to activities sooner. Summary: Spondylolisthesis is a condition in which a vertebral bone shifts out of place, making the spine unstable. This can lead to compression of spinal nerves, causing pain and other symptoms. Your doctor will determine the best course of treatment based on your condition.